So we're going to explore the green credentials of the health sector and what's being done to reduce emissions, what leadership is being shown in this area. And our panel for this conversation now is Derek Cawley, consultant spine surgeon, and Derek volunteers for Irish Doctors for the Environment. Susan Treacy is with us. Susan is CEO of HealthTech Ireland, which is the independent trade association for manufacturers, developers and distributors of health technology products. And also here is Dr. Ina Kelly, consultant in public health medicine, medical officer of health and health protection and chair of the Public Health Medicine, Environment and Health Group with the HSE. You're all very welcome. Give them a round of applause, please. And Derek, what is the health services record on emissions? It's not good, is it?
It's not good. Thank you, Audrey. It's not good. In fairness, what is society's record on emissions? It's not good, is it? And we are ordinary people working in healthcare and trying to do a good job. And we are faced with huge pressures that we've been talking about all morning. So the Climate Action Roadmap was published in 2021. The part of the HSE roadmap, decarbonisation roadmap, was published in 2022. A lot of it regurgitated stuff that had been previously published in 2021. And unlike the NHS, it's not embedded in legislation. So anybody that works in healthcare would know that if a patient aspirated what they regurgitated, they'd end up pretty sick. So similarly, we've got a kind of a wheel of stuff that keeps coming out. We know the climate crisis is a problem because 6,000 plus papers have shown this is on the horizon. We need to deal with this. So the reason that it's not moving at the level that we would like it to move is not for the lack of science. In fairness to our government, our legislators, our HSE exec, it's not for the lack of guidelines. Those things are in place. It's the culture. How do we enable people to change the culture so that they start respecting what we need to do with regards to sustainability and the environment? And there are such pressures on our healthcare staff. There's massive turnover. There's bureaucracy. There's time pressures. There's patient pressures. Where in all of that does it fit in that you should put the appropriate waste in the appropriate bin? That's a long way down the priority list. So that's an issue for us, and that's what we need to change.
Dr. Kelly, I wonder how much of this is given much or any thought on a day-to-day basis among staff in a hospital, in a GP care, wherever they're working.
Well, I work in public health, and so we work in a particular sector there in which I don't really see it on the front, in the day-to-day office life really, or it's changing very, very slowly. But we have had a lot of conversations at national level, I suppose, to try and influence this, but it just takes an awful long time. I'm not sure that it's really on the agenda. One of the problems, I think, for climate change is it seems to be it's seen as something that's going to happen in the future, and it's not going to happen to us very badly because we're probably not going to be as badly affected as many countries in the world, whereas we're dealing with crises every day, and so they're always going to be the number one thing we're trying to deal with. So we're not anticipating and planning properly around this, and we have to have some time and some of our resources have to be protected to do this work, I think. And now I know that in 2022 the HSE did start the climate action and sustainability strategy work, and we have got a strategy that waits to be published. We're hoping to see that, and then the next thing we have to see is a plan and an implementation of that. It remains to be seen how successful that would be. There's definitely loads of interest, and I know the World Health Organization, Euro, and their sustainability strategy talk about using healthcare workers as agents of sustainability. And we have a very large number of healthcare workers in Ireland, or people working in health and social care. So there's an awful lot of, I think there's an awful lot of personal involvement in it, but we haven't joined it up yet. And I think that's something that's a huge opportunity there. So it's just really putting it on the agenda strongly and allowing people to do what they can about this. And I understand. I think in the crisis it's very hard, though. So we have to be able to keep some time for that too.
It's really interesting and something that I personally hadn't given much thought to. And Susan, I'm wondering, is it something that an individual can do on an individual basis? Does it come down to practice? Does it come down to technology? A combination of both, presumably. But is perhaps personal behaviour, can that be more easily developed and changed?
Yeah, well, I think there's the goals for 2030 that need to be achieved, and then there's the goals for 2050 that need to be achieved from an EU point of view. Ronan Glynn touched on it earlier, the percentage of emissions. So healthcare is responsible for 4.4% of the emissions, which is more than the aviation. And actually his example of somebody 7 hours under anaesthetic is the equivalent to driving to Delhi absolutely blew my mind. So there's a responsibility on all of us. There's a responsibility on the individual. There's a responsibility from our point of view. We're a trade association, so we've over 150 members, and they're everything from startups, SMEs, global companies. So we have a value. We have a responsibility individually as organisations. I think the challenge is the scope is quite broad, and for some companies, they're much further ahead on the journey. So everybody's at different stages. So we put together, we have our regulation working group, we have our sustainability working group, digital health, and the board sponsors have a background in sustainability, and our chair is the chair of Friends of the Earth. So these people who are leading our working group have a real passion for this area. And what we've noticed is by bringing the members into that, they're just all at different stages. So some are in the working group to learn. They haven't done much at all. And then some, more so the global companies, are so far ahead and they have these experts.
And what are they doing, Susan? Can you give us some examples of those who are far ahead, what they're achieving, what they've put in place?
Yeah, so they have strategy within their organisations, they have dedicated people, they have budgets dedicated to it. So I suppose it's the same for every organisation. And again, Ronan talked about this. You know, when you're trying to meet a challenge, our budgets need to be allocated to meet these challenges, and resources and capabilities and process have to be to provide that capability to do it. So it is about having that focus. But I definitely think there's fantastic work going on. The HSE, the procurement team had reached out to us, and they brought together a group, Doctors for the Environment were on it, HealthTech Ireland, to help write the HSE sustainability strategy for procurement. So I think that was the first time ever that had happened, that everybody came into the room together. And equally, it's about us putting the right people in. So I would have gone to our working group and thought, well, who has the skills, who has the knowledge base to bring the best to the table? And then when that draft came out, it went back to the working group, and then it went back out. We put an industry position paper on it, went back to 60 members, and they looked at the gaps and that. So it's trying to pull together. It's a huge challenge. And whether it's regulation, whether it's digital health, whether it's sustainability, these challenges are global, and we're coming out of a pandemic, and we have a burnt out healthcare sector. You know, lots of our colleagues are exhausted by the last few years. So finding the energy to keep going. And I think the only way we can do that is to keep pulling together across the sector.
And Derek, I'm trying to get a handle on the practical outworkings of such a strategy, because the equipment that Ronan Glynn was talking about earlier, it's all absolutely essential for any hospital. So is it about new technologies replacing that equipment, doing the job that equipment currently does, but on a much more sustainable basis?
So the CJD issue, which must be, we said the new variant CJD outbreak, which is maybe over 20 years ago now, was an impetus for significant change towards the single-use items in healthcare. Now, bearing in mind that there has not been a single incident of hospital-acquired CJD infection in over 40 years, yet that was a thrust for a niche in the market for using something that can be made usually in the global south, in a country where there's very poor workers' rights, to be used and dumped without having to worry about, if this is washed, will this be as sterile? And that had a massive effect. Like, we have disposable curtains. We don't need sterile curtains. We just have to wash the curtains. And I get the argument that sometimes curtains can transmit infection. Why is it therefore that we don't have disposable door handles, which are the most infectious thing in any hospital? So the psychology is significantly flawed. So there's definitely a lack of direction. Professor Cook talked about we need to do something to change the system. Here's something that if we used this looming climate crisis as an impetus to change our attitude towards our carbon footprint in the health sector, that would be good for us as staff, let alone the fact that it's good for the climate, the environment, and how we think about what we use, which has a global effect. But by doing that, it would give people who work in healthcare a singular item that brings us together. We talked this morning about low morale across the health sector, because one of the things about low morale is that we're all fighting our own corner, whereas if we have a sense of common purpose, that actually we're all in this together, we need to tackle this together, that would be a good thing. So definitely there is a single-use item issue. Intrinsically linked to that, there's the waste issue, which I alluded to already. Bearing in mind that 4% of what we use gets recycled. 4% is all. Yet we see the recyclable logo on most plastics that we use. Second of all, we throw stuff into a yellow bin which gets burned. Obviously, highly costly, highly toxic to the environment. Okay, and it's intrinsically linked to the fact that it's a single-use item in the first place. So then you've got what the HSE has published on, which is the energy usage, which is obvious. Clearly, we need to reduce our dependence on fossil fuels. If I may talk about the NHS, they are world leaders on this. They are the ones who came up with the greener NHS strategy 2 years ago. They embedded it in legislation. They showed how they can be. We need to drive towards net zero. So that's a good model to follow, and we're seeing that across the world. But things could be worse. In Florida, for example, it is illegal for a state agency to use the word climate change in any of their official broadcasts. So at least we're not that. We're doing something.
I know. What do you think of this? I mean, is this something that needs to come from the top down, or can it be done at individual hospital group level? Can the initiatives be undertaken in various centres without that from the top?
Yeah, I think it has to be across the system. I mean, from a top-down perspective, I suppose we should, ideally have some measures that people are accountable for achieving. That's one of the ways, I suppose, of, we had previous talkers about accountability, and that's one way of maybe driving change in certain respects. But I think there are a lot of people who would like to do better and can't because the system isn't set up that way. And, I think we have maybe gone down decision-making that is faulty, as Derek's talking about there, that is hard to challenge. And I suppose maybe because it's a big organisation, it's just very hard to see where the levers of decisions are and who's making these decisions. So I do think that maybe, I can see that strategically we need to work together. Mm-hmm. And I think through the plan that the HSE is developing, I do think we need to make sure that actually gets actioned. That's the way, in a way, that we can all together be working, because you have to mainstream it across the system. And the way to mainstream things mostly is through the hierarchical structures that are there to make sure that they're actually expected, that that there's an expectation that that the basics are being done anyway, the sorts of things that we know we need to do. They need to be invested in as well, of course. And so there's a lot of goodwill, but goodwill, isn't sufficient, I think, because it's an organisation and we need all the organisation working together as much as possible. And I suppose to get synergies across the system too. But I think having conversations is really important because, and it's important that there's a lot of demand for it as well. I think that that's where civil society matters. I think in some of the talking earlier on about, I know in the environment sector we're supposed to have public participation. I'm not sure maybe we've got quite so much public participation in the health sector, and maybe we need to get more demand from the public as well, that this is happening, and in a way create the demand from every angle so that it becomes the norm.
Susan, is the technology available, the technology that might replace existing technology that hospitals and other medical centres use?
Yeah, I believe the technology is available. The technology is available to solve many of the problems through healthcare. I think often the technology is not the difficulty. The pathways are probably the bigger challenge. The procurement pathways, the proof of concept, the safety. So it's more about having them in place than the actual tech. But there's huge opportunities with the tech that's there. There's fantastic companies. Actually, one of the winners of our HealthTech Innovation Awards was the Happy Earth, the PPE, and it's all compostable. So there's wonderful companies out there, wonderful solutions out there, but it's how do we connect it in through the system? And that's, again, the same whether you're looking at digital health or whether you're looking at sustainability to really get those benefits. I think another factor is we're part of MedTech Europe, and there's a lot going on. I mean, you know, sit in these meetings with my equivalents in all the different countries, and we're ahead in some areas of sustainability and we're very behind in other areas of sustainability. But even knowledge sharing at that level, and that information's coming in from the EU Commission to feed that down all the time. But that can only happen through open engagement and that trust. And that takes time to build that up and to work through that. But I think time is against us now. Those dates are coming in fast, and it is really, we need to get action and get going with it. So.
Do you agree, Derek? And just on a point of procurement, are emissions and green credentials, are they now a condition of procurement?
In the NHS, they are a condition of procurement.
But not here yet?
Not here yet, no. Well, not even that. The procurement guidelines haven't been issued. It makes sense that they would. What will probably happen in Ireland is that the companies will just replicate what they've been doing in the UK for the NHS, because why change a system that they've developed and put a lot of money into for a bigger economy over there? So you'd expect that that the procurement would have a knock-on effect here. Yeah.
Ina, in terms of public health and the awareness of climate change, that link that's between climate change and infectious disease patterns, will you talk us about that?
I think something that's really less understood is the need for adaptation, because regardless of whether we reduce our climate emissions, Ireland is small, relatively small, though we can be a leader and give good example. But the inertia in the climate system itself is already set that we're going to have climate changes that we're going to have to learn to adapt to, and we have to build resilience to the impacts of climate change, both environmental and social and so on as well. And so I think with infectious diseases, for instance, well, I suppose the one thing I think we're very good in public health in surveillance of infectious diseases, and we're very connected to the world notifications of infectious diseases as well. So we can see early warnings of infectious diseases that might be emerging, new infections, and our investigation and control and prevention and so on are, you know, they're very active, and I think we've a pretty good record in many aspects of that. But of course, we monitor, you know, we're monitoring vector-borne infectious diseases and so on. So, you know, we do expect that things will change, but hopefully we will be modifying our systems and update, you know, and getting involved in prevention. But one of the things that is prevention, say, in relation to re-emergence of vaccine-preventable infectious diseases, you know, Ireland has had great success, say, in control of measles, for instance. And it's important that you have to maintain that all of the time. And with movements of people throughout the world, we're going to see that that's going to become more challenging. So we're going to have to become much more agile at providing vaccines much more quickly and make sure, and that's where trust is so important, because, you know, there have been an awful lot of disinformation about vaccines internationally, and it's really important that healthcare is trusted so that people recognise the importance of prevention. And I suppose maybe to do with disease prevention, that's a really important part of sustainability as well, because if you can reduce the demand on healthcare, you can reduce the consumables as well. Mm-hmm. So it's very important that we look at the life course and where the demand for services come along, and making sure that we're really active at preventing things that are avoidable, because that is going to be the most sustainable form of healthcare, and obviously the most ethical as well, probably, because it'll be invisible. That's one of the problems. People won't realise the value of it, probably because they may not see that the protections that are occurring for them. But that's really important for the health system itself, though, to be doing that.
Is it feasible to say that we will meet the targets within the health sector by 2030 and 2050?
It's not feasible. I guess what's happening here is that we're seeing having attended COP in Glasgow 2 years ago, that the conversation is moving very quickly from what we're talking about today, which is a conversation we should have had 20 years ago, to adaptation, the fact that we need to get ahead of the changes in our healthcare because of the climate crisis, because of migration, because of new infectious-borne diseases, because of newer pressures from a changing world. You got your flood disasters, you got your heat strokes, you got your air quality. These are all directly related, and these are adaptation things that we haven't even started thinking about yet. How many of our bigger hospitals are in areas that are prone to flooding? We know Cork gets flooded on a regular basis. Look at St. Vincent's Hospital. Look at Galway University Hospital. Okay, look at Limerick. These are places on estuaries of rivers which could well be knocked out of commission. So these are scary aspects of what's now known as collapsology, which we need to start thinking about as part of our adaptation to climate change.
And that's the point you make, Aina, about the impact of climate change on migration. Eventually, of populations having to move, whether temporarily or permanently or whatever.
Yeah. I mean, obviously, most displacements from people, you know, from when parts of the earth become less habitable, people will move. Unfortunately, and you know, I know that I was at a hydrology conference some years ago, and we think about there's I think they call it the ice tower, but in Himalayas there's a huge volume of stored water, you know, in the glaciers there. But you know, there's a huge populations being served by water from the Himalayas, for instance. If there's going to be huge changes in that water, you know, of melt and so on, and what's going to happen to the populations there. So we can expect that, you know, we can see the same in Africa. So many places are becoming, you know, desertification and so on is occurring. And so we have a duty to those people in the first place, because our emissions are causing destruction of their where they're living. And I know the European Parliament is getting very involved now and starting to recognise we need to be anticipating this. First of all, we need to be helping to prevent as much as possible and working with communities. But areas that can't be protected against, we need to think about how to have proper climate asylum and climate refugees, climate movements where they're planned, not where they're not crises, that there's actually an opportunity for people to properly migrate when that's needed as well. So I think it's something we're going to have to look at as a whole global world, and how we're going to look after the peoples of the world in the same ways, because I think it's going to put pressures on countries when it's unanticipated and unplanned as well. So I think it's something we're just going to have to foresee. So I think a lot of that predictive analytics is going to be needed for lots of different areas, and modelling, you know, and so that we can really plan properly for a health service and the whole of society as well.
Well, I'd love to hear from you, our audience, on this, what your experience, what your thoughts on this are. Health Summit 23 on Slido. Susan, just a final word from you on this.
No, I mean, look, we all know the targets that are there. We all know the crisis that's facing us. And I think what we can do is set up the structures and the frameworks that we can move forward together. And I think most of us in the room, we're past chatting about it. We want a strong strategic direction, cadence of meetings and guidelines and ways to achieve what we need to do. I would say as well, just as a final bit, the MedTech Forum are in Dublin in May, and a big focus of that is sustainability. So globally, with the World Health Organization, we all know that's there, but it's down to the individuals and together for us just to move it forward.
Great. Susan, Aina, Derek, thank you all very much for joining us today.